Thanks to Hollywood, whenever we hear the word heart attack, the classic movie scene where a character dramatically grabs their chest and falls to the ground comes to mind. But here's the twist. Heart attacks don't always come with the dramatic chest clutching and gasping for breath like in the movies. There's another type of heart attack that's much sneakier and harder to detect, and it's called a silent heart attack. Yet, as silent as it is, out of the 805,000 heart attacks that happen in the US each year, a whopping 170,000 of them are silent. That's why it's so important to know the warning signs. By recognizing these subtle signs, you can seek medical help before it's too late. So, let's dive into the top 10 early signs of a silent heart attack that you should not ignore. Let's start with this sneaky symptom. Number 10 is upper body pain. When it comes to detecting a heart attack, most people think of chest pain as the ultimate signal. But did you know that neck and jaw pain can also be warning signs? The truth is, sometimes our bodies can actually be a bit dramatic and throw tantrums by drumming aches and pains everywhere for no good reason. However, studies show that more than 40% of people who experience a heart attack feel pain in their jaw or neck before feeling any other symptoms. Symptoms like shortness of breath or nausea. This is because your cardiac muscle contracts with great force during a heart attack, putting stress on your bones and ligaments and leading to pesky aches in your jaw or neck. So if you start feeling pain or discomfort in your arms, neck, jaw, back, or stomach, like a grumpy old bear, seek medical attention immediately. Are you having trouble getting a good night's rest? You wake up feeling like you just ran a marathon, or like you're gasping for air. Well, it could likely be a sneaky sign of a very silent heart attack. At number 9, we have sleeping troubles. Getting a good night's rest is super important for our health and well-being. A study in the journal Current Cardiology Reviews found that restless sleep can up your risk of heart disease. It's because a blood clot or fat buildup blocked the left coronary artery, which means some parts of the heart don't get enough oxygen. This can cause alertness hormones like adrenaline and cortisol to kick in, making it harder for you to catch some sleep. So, if you're tossing and turning all night long, don't ignore it. Make sure you visit the hospital to be sure that your heart is in tip-top shape and getting the rest it needs. Now, we all know that sweating is normal, but when it gets excessive, you might need to get a chest x-ray, which brings us to number 8, excessive sweating. We all know that sweating is a natural bodily process, especially when we hit the gym or get under the hot sun. But did you know that an excessive sweating, especially when you're not being active, could be a red flag for a heart attack? It takes extra effort for the heart to pump blood when your arteries are clogged, which makes it harder for the heart to beat. As a result, your body perspires more to help regulate body temperature during this extra exertion. So, if you've been finding yourself sweating like you just ran a marathon across the Sahara while snacking and binge watching your favorite TV series on your living room sofa, accompanied by additional warning indications like nausea, vertigo, or lightheadedness, then you might want to think again and visit a doctor, because nothing is more important than keeping that heart of yours healthy and happy. According to research, up to 30% of heart attack patients complain of feeling sick before the actual heart attack happens. That's huge if you ask me, which leads us to the next sign. At number 7, feeling nausea. Have you been feeling quite queasy lately? You might need to see a cardiologist. Sounds a bit extreme, but many reported cases of silent heart attacks start with nausea and bloatedness. The reason is fluid retention. In addition, the heart is not pumping well. As we age, less blood circulates and is directed away from the digestive system into more important organs like the brain. This causes weight loss and muscle loss over time. If you're noticing changes in your appetite or feeling queasy, there might be more to it than meets the eye. And you'll never know until you find out. Book an appointment with the doctor today to make sure your heart is okay. Have you been usually tired? Well, it could just be another sign of a silent heart attack. Number 6 is fatigue. Been feeling exhausted lately? Before you reach for another cup of coffee, listen for a minute. Your heart might be trying to tell you something. It's not the most exciting news, but according to a study by the American Heart Association, 70% of women who had a heart attack experienced unusual tiredness beforehand. This happens because your heart has to work harder during a heart attack to pump blood when the blood flow is stopped, which causes you to feel extremely exhausted. If you've been fighting the urge to sleep 24/7, I really don't think it's something to snooze on. It's time to take action and get checked out by a doctor. Keep watching as we dive into the next 5 warning signs of a silent heart attack. Don't forget to hit that subscribe button and give us a thumbs up if you're having fun. Sure, you didn't see this one coming, but you might need to pay close attention to your feet if you don't want a silent heart attack to sneak in on you, which brings us to number 5, which is swollen feet or abdomen. When your heart is not pumping blood properly, fluid can build up in your body and cause edema. This can make your limbs and abdomen look and feel puffy and uncomfortable. Also, your kidneys may not be able to flush out excess sodium and water, which can also contribute to swelling. In fact, swelling is a warning sign of a silent heart attack in about 20% of cases. So don't blame your extra serving of salty fries for your swollen feet or abdomen. The fries might be innocent. Don't brush it off as a fashion faux pas either. Just stop by a clinic and find out what's up. Do you know that breathlessness is another subtle sign? It could be your heart's silent cry for help, so make sure to listen. Number 4, shortness of breath. Shortness of breath is that annoying feeling when you just can't seem to catch your breath. It could be caused by stress, allergies, or even low iron levels. However, it's often linked to heart or lung problems, especially in women, because women have smaller airways and lungs than men. During a heart attack, the heart muscle finds it difficult to pump blood effectively. This restriction can affect the flow of blood, particularly oxygenated blood, around the body, which can cause shortness of breath. So, if you find yourself huffing and puffing more than usual, don't ignore it. Call for help as soon as possible. On to number 3, which is lightheadedness. A heart attack is mostly caused by the lack of oxygen because the blood supply to a particular part of the heart is blocked. So if the heart is not able to perform its functions of supplying blood to every other part of the body, other body parts start to fail, making you feel dizzy. It's very possible to experience dizziness symptoms, which are usually triggered by stress and dehydration. But even so, if it becomes consistent, don't just brush it off like it's nothing. Check with a doctor to make sure everything is in tip-top shape. Did you know that getting the flu could mean more than just a stuffy nose and fever? It turns out that having the flu could increase your risk of a heart attack and stroke. Because at number 2, we have persistent coughs. A study found that within a week of getting the flu, your chances of having a heart attack go up by 600%. Don't worry, it's not the flu itself that causes permanent damage to your heart. Instead, it could be a sign that there are underlying issues that could lead to a heart disease and other cardiac problems. So if you notice your heart rate going up, shortness of breath, or chest pain or pressure while battling the flu, it's time to call the doc. Now this last sign might come as a surprise, but it's very true. If you love to drift off to dreamland with a little snore action, hate to break it to you, but that snoring could actually be a sign of something more serious. And lastly, number 1, the infamous squeezing chest pressure. Chest pressure is a sign that something is going on with your heart. It's called angina or substernal chest pain, but we like to call it the unwelcomed cramp from hell. The pressure can feel like a cramp, but it usually only lasts a few minutes at a time. Chest pressure could be caused by a variety of things, some of which are not related to your heart at all. It could be due to a pesky esophageal issue, lung troubles, stress, anxiety, or even a musculoskeletal injury. However, if you do experience this discomfort in your chest, it's essential to act quickly to reduce the risk of any potential damage to your ticker because your heart is the life of the party. Heart attacks are one of the top global killers, but don't let that scare you. Small steps can make a big difference in reducing the risk. Things like munching on healthy snacks, getting your body moving, and ditching those smokes can do wonders for your heart health. And if you ever experience any symptoms that concern you, don't hesitate to reach out to your doctor for some expert advice. Thank you for being so patient up to this point. It's greatly appreciated. Subscribe and enable alerts to avoid missing out on future videos from us and much more. Check out this video to learn more about how to care for your body, and we'll see you in the following video. Stay safe.